Hi everyone, I'm going to try to pick up from where Jane left off, although my presentation is a little different because I'm talking about more community services and financial and assistance and related programs, which are things that's, they're concerned and interwoven with health, but a lot of it is how does someone really support themselves as they're an adult with a disability. So my objectives are these. I'm going to talk just a little bit about transition planning, which happens in the special ed system, is required to do a transition plan so that the student kind of goes from the education system to other systems that support and help the individual kind of get that adult life and find out kind of direction where they would like to go, what do they want to be doing after school. And then I'm going to identify some programs, and I want to talk a little bit about how Social Security defines disability because it's very specific to Social Security. And we're going to look at a couple of the disorders and how they define it, just so you get a little bit of an understanding of that. And then, overall, this is how do we assist a student and a family to have a smooth transition. So a lot of parents, when they first think about their child leaving school, the school has provided a lot or most of the services and supports that they have received for their child outside of probably medical support. If they don't have a lot of that, the school is really the main provider. So a lot of times families and the student are feeling like I'm about to step off this cliff into this world I don't understand or I don't know. And this is a picture from my hometown in Newport, Rhode Island. It's called the 40 Steps. And before this staircase was built, which goes down a cliff in Newport, it was a cliff and it was a sheer drop. And so I think about this as we have to find, what are the steps, what are the things that will support a young person who's transitioning from kind of their youth and being in that student role to more adult roles. So it's how do we navigate through this time and how can we support families and students through this time. So here's the first polling question. When does transition planning begin? So at some point in time, all of these were true. So, and I think that A is true all the time, as soon as possible, because students and young people and families are always in transition at some point. It used to be, originally the IDEA said you would start a transition, traditional kind of transition planning that's structured by the school on the student's 14th birthday. A few years back, that got changed to the 16th birthday. But it says in the actual regulation now, no later than the 16th birthday, the student's 16th birthday, and earlier if needed. So D is the correct answer, but I think you're right on when you say as soon as possible, and we can be helping that family think about transition, even if the school's not going to officially call that, depending on your role with the family, you can be supporting that notion. One example I give is I used to teach in elementary school, and this young girl, I think I was teaching a 4th grade class, really nice, very sweet young girl, and she arrived to my class, and she was welcomed by my students, and for the first few months I kept thinking, gee, is there something else I don't know about her? And then I did ask, and it turned out she did have an IEP, but the school did not get it to us for 3 months. So that was for me a lesson in how do we make sure we have all the tools we need to help someone transition before they start the transition. So the Individuals with Disabilities Education Act, the IDEA, this is what they say, some of the language related to transition planning. So it's really, from my view, kind of a bridge to going from your, your student days to kind of this entering your young adult hood, in a sense, because not that you're all grown up at 18, but as a society we say 18 is kind of this mark, and it certainly means your services change. And that is, as you probably most of you recognize, that's the Golden Gate Bridge. So one of my goals and dreams, and we'll talk about that in a minute too, but one of my goals and dreams was to walk across the Golden Gate Bridge, and I did do that several years ago. I went to a conference in San Francisco, and I fulfilled that dream. So part of when we talk about this stage of life too, and we start talking about person-centered planning and what does that mean? It does mean talking to young people about their dreams for the future, starting with dreams and then kind of figuring out what does that mean in terms of goals and how are we going to get there. For education, these are the activities that might be included that the education system during that transition planning might talk about. So whatever clinical role you're in, you probably do want to know a little about what this child or youth now or young adult is in front of you. You know, what are they doing now? Where do they hope to be? How does your work or your expertise integrate with that, helping them to get integrated and to achieve some of their goals and dreams by pursuing different things, such as maybe more education or a job. Some of the programs we know about for post-secondary education, there's a program called Think College, and it's in several universities, quite a few now, and that has programs for people with intellectual and developmental disabilities to attend college alongside their peers. So vocational ed usually starts with, it could be they start some of that in high school, but MRS is invited usually to the last kind of transition planning meeting, and they're supposed to help the person, if they want, set them up with like a vocational assessment and kind of introduce them to that adult world of vocational rehab services. And then when the assessment's done, there should be help to help find a job. So I have to say, just from experience, and we know that MRS was set up to deal more with people with physical disabilities, kind of veterans and people who were coming out of maybe war situations or just had some kind of an accident. So they do work with folks with intellectual and developmental disabilities, but I think their expertise isn't really in that area, so they're a bit limited in that. Supported employment is something we see that happens. Mostly where I see this, MRS might offer this, but mostly it happens through the community mental health developmental disabilities system, and it might mean that someone has a job coach who goes and kind of side by side teaches them a job. And this is with, the employer understanding that the job coach is there to help guide the person with a disability, and then eventually you hope the job coach can kind of fade out. That person doesn't always. Some people always have some job coaching, or that you might work in an enclave, which is a group of people with disabilities maybe working in, like in my county, they clean a lot of the county buildings, and they have a supervisor that roams with them to each of the buildings to do the cleaning. There are other services that are offered too by the local community mental health developmental disability services, and these services we'll talk about too in a minute. So the whole point is to try to connect the person and the family to what's coming next. A lot of times they're going to not connect with all of these at 18 because maybe they're not ready or they don't need it, but some people do need it, and it's really useful to have a discussion about that. What's kind of up next in the next year or two for this person. This is the people who by law are invited to the transition plan. So the thing that I kind of see here is, the student does not have to be present, which I always find really kind of interesting. So what usually happens is if the student, in some places they will not have the student there if they're nonverbal, which doesn't make a lot of sense to me. We always think it's best to have the person in front of us who we're talking about. But if the student is not able to handle it for some reason, like if emotionally it's too upsetting to be in a room with a bunch of people talking about them, that might be a reason for them not to be there. So I was thinking about transition. It's kind of that now what moment, and I've started going through that with my own daughter a few years back when she was getting toward the end of high school, and we were thinking about, okay, college, the former president, and Mrs. Obama had to think about it for their daughters, one who was college age and one who I think is now finishing up high school. So everyone has to think about this at some point, and usually throughout your life there's transition times. And so what are some transition times that you can think about that you've experienced in your own life? So what are some transition times that you think people go through or you've gone through in your life so far?
Hi, this is Mike. So a transition time that I can think of was when it was between high school and college, I moved out into my own apartment, which was very different for me. So it was a bit of a transition. And then now going into the next stage of my life, after getting almost getting your PhD, there's a whole nother transition of moving across country or across to a different country in some cases, which is definitely a bigger transition than what I expected.
Yeah, those are really good examples. Let me ask you this. So when you were probably about 18 when you left home to go to college, and you got your own apartment. Is that correct?
Right.
What was like surprising about that for you? Like when you, I don't know, just kind of woke up in your own place for the first time? Yeah,
so learning very quickly the things that you kind of took for granted that your parents did. So just even small things like having food in the refrigerator, like that just doesn't pop up like it used to.
Right.
With your parents, or just your clothes were washed. Yeah, there's small things like that.
But they kind of add up to a lot of responsibilities, I think, that we don't think about, like you said, when we leave. Right. Or move out of our homes, right?
Yeah.
Does anyone else have a transition that they can think of that was kind of meaningful or?
Oh, this is Molly. Yes. I think another transition is gaining more independence, such as, getting your driver's license. It became your responsibility to know where you were supposed to be, when you were supposed to be there, rather than your parents reminding you because they were taking you places.
Right, so you were kind of responsible for your own schedule and getting yourself around.
Right.
That's a big deal because you have to really plan and think about your day and what you have to do and how are you going to get places, and that's a really good example. So I think for some of the people we work with who have intellectual and other neurodevelopmental disabilities or autism, they need varying levels of support to kind of do that and learn those things, and it just depends on who they are and what kind of support they already have and what they know. But there's still all those connections to be made that they need to be supported to do in their families. So, to move out or to get a new job or trying to think through, how does my day work? And these are all things that you have to learn how to do and organize yourself to do. It's also a time, I think, this transition time when you're kind of trying out relationships and different schools, or, trying to decide what am I going to major in, and or what kind of job do I really want to do, or what's a good job for me, and then also firming up your values and kind of just what you think your world outlook. So these are all things too that people with developmental disabilities do as well. So families ask sometimes, there's a concern because this magic number of this former child is now 18, all of a sudden they're an adult overnight. So this is some of the questions they ask. So what are they? Is there going to be an impact on my taxes? What about how are they going to get a job? Some young people have SSI as children, and you have to reapply almost for the adult benefit. It doesn't mean that if you have child benefits, it's going to carry over. Depends on the disability and other things such as income. The income things change and all that. What if my son or daughter is not able to live it totally independently but needs some, support? And right now, I think somebody said this in one of our other lectures, currently it's like 70 or 75% of families have adult children with developmental disabilities still living with them. And I think that's a huge kind of need that is kind of waiting to explode as the baby boomer generation gets older and more infirmed and won't be able to take care of these adult children. So I think we're going to see some need for increased services. So families do have options, and one of the big places they can get some of their questions answered is through the local ARC system and the Michigan ARC. For example, the Michigan ARC publishes a pamphlet or a little booklet on doing your taxes, and it talks about concerns around, having now an adult child, so to speak, with a disability living still at home, and maybe they have some kind of Social Security disability that they get. How does that count? Or they have a job, and how do you, figure out how to kind of maximize your tax benefits because of all that. So the ARC is a good place to just call to for kind of, regular information or something that you may not know, or to send a family to for information about resources and other services. So what are some questions you think an emerging adult, as like it's termed, might have as they are getting ready to leave school? And you can think about an adult with a disability or not, but just what are some questions that they might have?
Hi, this is Shanae. One concern might be financial. How am I going to pay for living and other costs that might arise?
Yes, yeah, big question. How am I going to support myself? Do I have to do that, or are my parents helping me out or not? Good question. What are some other questions that emerging adults might ask or be thinking about as they transition?
This is Molly again.
Yes, hi, Molly.
I think, how will I take care of things? Like how will I do laundry? How will I cook? How will I grocery shop? How will, all the various things that,
Right.
like Michael was saying, we kind of take advantage of living with our parents. And some of those things they might not even think about until they have to be on their own, as I'm sure many of us have experienced.
Right. Yeah, exactly, because unless you experience it and do it, it's really hard to know it. So I was surprised, like my daughter would call, I think especially the first year she was away from home with questions, and I thought, gee, didn't we cover that at some point? But no, she hasn't lived it yet. She's on her own. It's a different experience. So, she needed some kind of guidance about that. One was because she's in another state, about how does she get money out of her account? What bank could she use? That kind of stuff, because she was always able to just go to the bank here at home. So just things like that you're not going to know just because you don't know it. So yeah, I think there's a lot of questions too from adults who are, transitioning about what are they going to do, and you've all been in transition at some point. So it's, it's a very exciting time, but it can also be stressful for people as they try to figure out what are my next steps. So, transitioning youth with disabilities, as we've been talking about, are also adults who are building a life path, which is how I kind of see it. And so there's community services and supports to aid in transition, but again, you have to know what they are and find them, and then kind of get engaged with them. So, oops, sorry, let me go back. And the other thing to know is that, and I think we've talked about this a little bit or briefly, is that a lot of disabled adults are poor. And why do you think that is? Why are people with disabilities among the poorest in the nation?
Well, based on some research that I've done, this is Michael, the unemployment rate in those populations is extremely high.
Yes.
That is due to various factors, people just not wanting to hire individuals with disabilities, lots of different things.
Yeah, that's the big reason, is they're very, very underemployed. So, and that is a big issue. And we don't have a lot of, we're trying to work toward that, to do better supports so that we can also work with employers and folks with disabilities to make good matches and find out, and there's a lot of employers out there who do hire people with disabilities, but I have to say, when the economy is good, there was a lot of hiring going on, and they were willing to carve out a job, which means they might, I had a client who he couldn't remember where to stock things on the shelves. The job at the grocery store was you stocked, you bagged, and you brought the carts in. So he could bag and he could bring the carts in, but he never could kind of put stuff away on the shelf. So they just let him do the two things he could, and they gave him kind of reduced schedule because he also didn't have a lot of stamina. So he worked like, I think, 3 hours for, at a stretch for 4 mornings a week or something like that. So that was considered a carve out. But that's not a lot of money either. So, we have benefits partly to help that with that. The other thing that happens is, and this is more for older adults, is people who work in really physically demanding jobs. There was actually kind of a category that they used to talk about, and I think they still do. I did a lot of Social Security disability work for about 10 years. I represented people in hearings, and it was called worn out syndrome, and it was just people who worked and wore out their bodies. So people who worked on the auto lines, always doing kind of repetitive motion or lifting things or having to bend over all the time. Your body gets worn out basically. So you might have kind of general worn out syndrome with a bunch of different things wrong with you. And so those people are not employable either. So you see kind of more people as they get older go on disability. So for people with disabilities, though, I think what we do see is parents often are in the position that they feel, they have to help out the child with a disability who might not be able to get a job to support themselves fully. And we know even if you can get a minimum wage job these days, it's not exactly a livable wage. And then there are state and federal government programs and supports. And what you really need to do first is get Medicaid, because that does bring you a lot of these benefits and supports if you have an intellectual or neurodevelopmental disability or autism, included in that. So I just I'm going to briefly just talk about these community supports that were some of the major ones when I was working as a social worker that I would help people get. So SNAP is what used to be called food stamps. And so an employment assistance is kind of, we've talked about that already, but there's some other programs that you can access that through the Department of Health and Human Services. And then like Medicaid, the community living supports is usually what I would term come under your community mental health agency and the developmental disabilities services. And then Social Security. We'll just look at those briefly. So one question I did have for you is, who would you say make up the majority of the recipients of the SNAP program, the food assistance program? Does anybody have any ideas about who are the recipients of the food assistance program? Have any of you ever helped anybody apply for food assistance or been involved in that process?
Yes, I have.
What was that? And what was that like?
When I used to work at a resettlement agency for refugees and immigrants, we would help the newly arrived refugees apply for benefits, and one of the benefits did include food assistance. So that's usually for low-income families and families with younger children.
Mm-hmm. So it turns out the main beneficiaries of food assistance are the elderly, people with disabilities, and children. And those three groups make up about 80% of the people who receive food stamps or food assistance. We don't call it food stamps anymore. So I just wanted folks to know that, because it is, and it's a crucial program. Your income has to be really low to get food assistance. So it's an important one, though. It's important for people with disabilities because it does help provide some, nourishment for them and a way to not have to spend maybe a small paycheck or a small Social Security check on food, all of it on food if they have housing or electric bills and et cetera to pay. So I want to talk about Social Security benefits. There's two types, major types of disability benefits, as you can see here. And this shows you kind of how they're divided up. So the SSI is needs-based, and you have to have limited assets and income. And it comes with Medicaid in Michigan automatically. Other states do things differently, and they may have you apply for Medicaid separately. But in Michigan, if you qualify for SSI, that qualifies you for Medicaid. And if you're married, your husband or wife's income is deemed to the other spouse, which means if you're applying for SSI, they're going to count your spouse's income as part of the income that they look at to see if you're eligible or not. There's no waiting period. And then the Social Security disability, you're insured under someone's work, so it has to be someone who has a work account with enough, quarters or credits to have either retirement or disability insurance credits. And then this comes with Medicare after 2 years. So at the bottom here, it says you must have a severe disability, and then here, it's not showing up. Whoops, sorry, I'm going to do this. So there's something called substantial gainful activity, which is your earnings. And so what basically it cannot be, it's $1,300 a month in 2017. So if you're making over $1,300, you're going to automatically be disqualified for disability benefits, SSI or SSDI. So what do you think the monthly amount of SSI is in this year, 2017? So that's a polling question.
Hey, Ann, 58% chose B, $606. 33% chose C, $735. And 8% chose D, $908.
Okay, so the correct answer is actually C, $735 a month. And so you can imagine that's not a lot of money to live on. The assumption has been that an SSI would be supplemented by other programs. So right now the SSI rate is about 75% of the federal poverty level. And some of the things that supposedly you're supposed to be able to get are food assistance, housing subsidy, maybe some heat subsidy or whatever. However, that has not a lot of those programs have been cut, and so a lot of people have not been able to find, say, a subsidized housing, or the bigger picture for people who use wheelchairs and other mobility aids, finding something that's subsidized and accessible. That's a real challenge to find any time, unless you get into a building that has, was built with that in mind or is fairly new. But to get into a fairly new building, usually the rents are higher, and then the Section 8 doesn't qualify because there's a limit on how much you can spend on an apartment. So it's very tricky to find someone with a disability an affordable place to live. And you can see here too, the couple, it doesn't double. If you have a couple where both are disabled, it's or one's disabled and one's not. This is the maximum benefit that they can get. So the other thing, I'm not going to talk too much about income, but it does include wages and some other fees and consulting fees or self-employment. And then unearned is also looked at, and that's the things that are listed here. So what the Social Security, now we're talking about Social Security disability insurance, which is the one based on someone's work account. So that you can see here, you have to have, and I believe it's 40 credits, 10 years to qualify for, getting retirement or disability. So one of the things to know here is that if you're looking at disability where the adult child or is going to collect on a parent's account and the parent is deceased, disabled, or retired, the disability has to have occurred before age 22, and that's per the Social Security Administration. You have to prove that it has. So the best thing to do is usually to apply for Social Security benefits or SSI before the person turns 22 to establish that. And then again, they must be unable to work due to a severe impairment. And then this comes with Medicare after 24 months. So it's unfortunate, but people have to wait 24 months, even if they're eligible for Social Security disability insurance, they have to wait for the Medicare payment. So now with the ACA in a lot of states, the Medicaid eligibility has been increased to 133, I think, % of poverty. So more people might be eligible and have Medicaid during that period of time, but not always. So although I think it's more of that happening now. So how is disability defined? So in general, it's categorical, which means Social Security defines disability by categories of disabilities. And in a second, we're going to go to their webpage and look. It looks at the severity of your disability. So you can have a disability, but it also has to meet a severity criteria. It's expected to last at least a year or end in death. And then it results in an inability to perform that substantial gainful level activity, which we saw a few slides ago, which is it means you can't earn $1,300 a month or more. You have to, you're not able to earn that level. And then I want to talk about the blind, so substantial gainful activity is a lot higher than everyone else. And we have a chart to show that. So if you're blind, you get to make a lot more money. And here's a chart that just shows the differences between that. So if you go down to 2017, if you're a blind person, you can make your substantial gainful activity level is $1,950, whereas if you're not blind, it's $1,170. So what do you think? Anybody have any good ideas why that might be the case? Why you, if you're blind, you get to make more money before you're considered not disabled? Oops.
Hi, this is Molly.
Hi, Molly.
I think possibly there's many jobs that are not necessarily set up so that people that are blind could do those jobs. So maybe before it being considered a disability, there's not as many jobs available for people with that particular disability. And so maybe that's influencing the discrepancy.
Yeah, I don't know. That's a good, I hadn't thought of that. But really, I mean, when we look back historically, they just had a better lobby, people who were blind, from like the 30s on. So somehow it started happening a really long time ago, and maybe that was the thinking behind it, that there's less work available to someone who's blind. But again, when we split apart categories, there might be other people in other non-blind disability categories which is just much trouble getting a job. But you know, when they finally do, so it's just not fair anymore for whatever reason. It did start a long time ago, but it's just one of those quirks of the Social Security law. I like this, when I did training on this, I would say, you know, the Social Security law was enacted in 1935, and every Congress since has had a whack at it. And literally, Social Security regulations encompass several hundred thousands of pages because of all the different rules and things that have been promulgated all over the life of it. And then there's some states that have different rules that they've been able to get in, and there's just some odd things in it. So it's pretty interesting. But yeah, that sounds reasonable. I think there was probably some reasoning at that point, but now it's this big gap. And I want to go just show you the Social Security mental. So what I did was, this is the Social Security site. If you go to www.ssa.gov, and that's part of your homework, is to just go explore these sites. And then one of the assignment is to either go to the DHS site, which we're going to see in a minute, or this site, the Social Security site, and kind of explore one of the disabilities and what you were surprised about. So this is the intellectual disorder. And so what you see here is it's satisfied by 1, 2, and 3. So you need to, all those have to be satisfied. Severe, sub-average, general, intellectual, functioning. Number 2 has to be satisfied. Number 3 has to be satisfied. Or if those, and this is new, so this is a more functional definition, which just recently was put into the disability evaluation piece here, or they give you IQ scores here that you have to be under. And you also have to have significant deficits in your adaptive functioning, and they keep going down and say so you have to kind of follow it and see, oh, okay, and then I need manifested by extreme limitations of 1 or marked limitation of 2 of these areas of mental functioning.
And Lisa has a comment.
Yeah. So what I was thinking in regards to when you said about, people who are blind can make so much more money than other disabilities, and why is that? And working closely with the Children's Special Health Care Services program, which follows Medicaid policy, and seeing a lot of discrepancies in what we cover for like habilitative services, etc. My belief must be that, especially due to medical advances, a lot of these people that live today for so long were not living that long back then when this was created. I assume, and I don't know what kind of viral illnesses or other epidemics that were occurring many years ago that may have caused blindness, but I'm assuming a lot of people, if you became blind, you didn't maybe have all these other health issues that medical professionals couldn't cure. I mean, consider the fact that people with Down syndrome are living into their 50s and 60s now, when it wasn't that long ago the life expectancy was just in their early 20s. So that was just my thought on it.
Yeah, it might have been, that's a good point, it might have been there was a lot more people that were identified as being blind back in the day that, so there are some efforts to try to make the substantial gainful activity levels the same for everybody, just to be fair. So anyway.
Yeah, I just think that the medical advances, we're living so much longer for heart defects, et cetera, that couldn't be fixed previously. But yeah, a lot of work to do. Thanks.
Yeah, thank you. So this is, again, looking at IQ scores, this is just the the intellectual disability piece. So it's one part of the, what they call the mental disorders. So if I go back up here, and it's interesting to read. I know it looks like a lot of language, and it is, but it's kind of interesting. You can see this is the categories, right, under mental disorders. So does this include all mental disorders? It doesn't, right? So we can probably think of a lot of other disorders that might be under mental disorders that might be just as debilitating. And you can still apply with another mental disorder, because there's a caveat in here where the language says, or another disorder that, is as functionally, limiting and you're severely disabled as these other ones. So you can kind of look and see if one is close to another one or has kind of the same limitations but may have a different name. So that's just one category, and we'll just look at one other one for adults. So if you see here, say, neurological disorders, you see there epilepsy is up there, and there's different ones here. And again, there are a lot of different diseases that are kind of affect the central nervous system, and if you find one that's not listed here but it kind of is similar or meets the functional criteria that is set out, then you can argue that too. So it's kind of complicated. It's good if you know someone who can help you kind of through the process. Again, the ARCs are sometimes able to offer that kind of advocacy, so they're worth looking up. Also, if people are denied, they should always appeal because whereas about only 30% of cases, first applications are accepted for disability, over 60% on appeal are found in safe, so those decisions are reversed at twice the rate, basically. So here's some other things. Now we have the Michigan Department of Health and Human Services, which administers these other benefits, including Medicaid and healthcare, other healthcare. And we're going to look at the Bridges site too, which is the portal to all applications for these services. Excuse me. And again, these websites are in your reading list, so you can go to them later. But if you look here, you can see here's the Healthy Michigan Plan, Medicaid, My Child, which is for low-income children. It's a health plan. My daughter was on that for a while. Health care coverage, food assistance, cash assistance. So cash assistance is a couple of different programs. One for families, it's temporary assistance to families. And there's also a state disability program that kind of is supposed to tide you over till you get your federal benefits. Child care and emergency services, payment for things like if you have too big a bill to get your utilities put back on, you can get some money towards that, things like that. So the other thing you can choose to do is either go into the system and actually create an account yourself and apply for something and see what that process is like and just write up a little bit about it. So when you have people come in who are very low income, or you know, I don't know if you ask if they have these things, but one of the big programs for nutrition for women and infants and children is the WIC program, which provides food and other, you know, it's mostly food for women, children, and infants to increase nutrition of women and infants and their children, on top of food stamps or food nutrition assistance. So the other program that's a big one for people with developmental disabilities is the Community Mental Health Developmental Disability Services programs, and it's called different things in different counties. So I put a link to a list of all the local community mental health agencies that you can contact or send someone to for help. So as the person's going to turn 18, usually a few months before that's a good time to call folks. If the family wants to get involved, they should call to get kind of started with the application process to community mental health. And again, it's an application process, and they kind of look at your functional. It's different from Social Security. It's the definition I used in another PowerPoint around it, the functional definition of needing assistance in 3 of 7 areas, having, you know, some limited functioning area in those areas, such as economic self-sufficiency. I think it was called self-motivation, or being able to kind of, you know, direct yourself throughout the day. I'm forgetting some of the other ones. Language, receptive and expressive, daily your activities of daily living, being able to do those. So there was 7 of those areas. So, and they will ask you about that. And again, it's helpful for the person to have someone who knows the young adult or this new person who's about to become an adult, who can talk about maybe how their health conditions might impact their functional abilities. So you may get asked for a letter about that if you're working with someone. I would often, when I was helping people access services, you know, we would ask the medical professions to either fill out a form that talked about kind of what their areas of functional ability and disability were, or have them write a little letter about how this would impact their ability to do those 7 different areas. So what they offer in that is, if you get in, is the person-centered planning process and the community living supports, which are like having supports in your home, either if your adult child is still living with you, or if they have moved out and are in their own place, or sharing with some other people. It can include housing support sometimes, employment services like we talked before, the support in employment, and then helping you figure out what you want to do. Do you want to volunteer, or do you want to do other things? You know, what's your kind of community engagement going to be like? And then supports coordination is like the case management, kind of that overall coordination. It's kind of like a medical home, but this is for your social and community and housing and your other needs, employment and all that. So it's different. The person-centered planning process should lead to or be part of the individual plan of service. So the person-centered planning is really that looking at building on the individual's capacity to engage in things that promote community life and honors their individual preferences, choices, and abilities. So, and it involves everyone the person wants there. So we often have person-centered planning. It's a process too. It's not just an event, we say, so it could go over a few days. It goes up, you know, it's followed up throughout the year. But you could have just anybody you want to be there. You know, even your pet, if you really want them to be there. And then the individual plan of service is what the community mental health has to provide for everyone, and it should be guided by the person-centered planning process. And it includes these things too. So this one too also looks at getting down to their need for food, shelter, kind of the basics, things that people need to survive. The other one I would just talk briefly about is housing assistance, and housing assistance is something that people usually need if they're going to live, or they're, and sometimes if you go and hook up with a community mental health provider group like Community Living Supports, and I'll show you their page as well, because they're one of the more person-centered, they use person-centered planning. They look to do very self-determination and individualized supports for people. So, you know, if you want to look at a provider agency that provides kind of really everything for adults with developmental disabilities, I would look at, this web page, and that's also, I think I should have included that too. I hope I did. If I didn't, I'll put it out somewhere else. So people do need subsidies because housing is expensive. So a lot of times if you're involved with an agency, they'll try to help you get a subsidy, or people may end up sharing a place with one or two other people. There's also home ownership options for people, and there's some specific, I don't know why that keeps doing that, some specific to people with disabilities. So, and those are things that you can look at through the Michigan Housing and Development Authority. I don't know why it keeps slipping, but I guess we're trying to get done, huh? So anyway, I just had these questions about the life considerations. So what, and these are for you to answer, and we'll just have a little bit of a discussion and then we'll wrap this up. So what do you see as your role in ensuring that your clients and patients have access to basic needs and supports? And you might want to just reflect on your clinical role, and I don't know if that gives you the opportunity to work directly with people, or are you referring people, or are you referring them to someone in your organization? What do you see as that role kind of in the setting that you're in currently, or where you envision you will be? Is there anybody on who hasn't answered a question already? I think they should start us off.
And this is Shanae. I think what I see my role is knowing who to refer to that can help them through the process. So, I can refer to places such as Early On and things that we've talked about tonight, but really just knowing who to send the patient to that can then help them through the process better than I'm able to.
Right. So that, yeah, and I think that's it, is I think it is part of your role is to have that knowledge of what's out there, what are the supports, or know somebody who could help the family get through that. So, and it just depends on where you're at. I mean, where kind of a setting you're in. In some settings, they might be able to help somebody apply for food stamps, or they might send them to someone who could help them. In terms of family-centered care, how does this how does this align with what, providing family-centered care, having people's basic needs met? What's your thoughts about that? So I guess one of the questions I'm asking is, how do you see, what do people kind of have to have in place before anything else, before they can really engage in much, maybe in their own health care or with their child, actively? What has to be in place before that? All right, you psychologists, anybody studied Maslow? In order for people to really engage, they have to have food security, housing security. They have to be and feel not, they have to be safe. So kind of those basic physical and emotional needs need to be met. It's very hard to engage with people who don't have those met because they're constantly worried about, how am I going to eat next? Where am I sleeping tonight? That kind of thing. So sometimes I think, over the years I've realized really checking in with people about some of that, if you're suspicious they may not have all those in place, will help them to be, that's the essentials too for people to have a healthy start. So, I'm not sure what situations you'll all end up in, but, if you suspect someone has not got their basic needs met, it's really helpful to ask them and try to help get them again hooked up with someone who can help them access those. And if you have any questions at some point, or if you have questions about where to send someone, you can always ask me too. We're still here at DDI. We know what the resources are too out there. So, all right. Well, thank you so much. Have a good evening then.